moderating today's seminar that's presented by Myrna Al-Mansri, who's here. Before we begin, I'd like to acknowledge the traditional owners and custodians of the land on which the seminar is taking place, which is the Wurundjeri people of the Kulin Nation, and I pay my respect to their elders past and present. I'd also like to extend this acknowledgement to any First Nations people with us today, and those of you who are joining us online from other traditional lands across the region. So today's seminar is hosted by Melbourne Climate Futures here at the University of Melbourne. And MCF, or Melbourne Climate Futures, brings together research and expertise from across the university to learn, educate, and guide discussions on climate change. So just to note that this seminar is being recorded, and the recording will be available on the University of Melbourne's YouTube channel if you watch together later. So we'll be running a Q&A after the presentation where we'll take questions from all of you here in person, but also any questions that come up online. For those online, please use the Zoom's Q&A function located at the bottom of the screen to leave questions from Myrna throughout the seminar, and then we'll pick them up during the Q&A session. And you can also use the upvote function for those online to upvote questions that you particularly like to be answered. So we're delighted to welcome today Myrna Al-Mansri from the University of Bayreuth.
Perfect.
Myrna is a research assistant at the Chair of Planetary and Public Health at the University of Bayreuth. She holds a Bachelor of Science in Nutrition and Dietetics and has over a decade of experience in biology. Seeking a global interdisciplinary perspective, Myrna pursued a master's in global food, nutrition, and health. Her thesis examined cultural impacts on sustainability, knowledge, and eating behaviors, earning 2 awards for its significance in sustainable development. Myrna's work continues to focus on sustainability and planetary health, contributing effectively to the field through both her research and the UBT Green Talks series, which is a podcast series that Myrna runs. And I'd now like to hand over to Myrna to kick off today's seminar.
Thank you so much. Hi. Well, first, thank you again for the introduction, and thank you for the Melbourne Climate Future for this opportunity. I'm very delighted to be here today and to be able to give this presentation. So without further ado, I'll start. I think I have to. Okay, that works. So, my name is Myrna Al-Mansri. I'm a research assistant at the new chair, actually, of Planetary and Public Health at the University of Bayreuth. Our team is quite small and new. We started February this year. And actually, that's a very recent picture, 2 weeks ago, I guess. So we're still all well dressed up because it was 5 or 8 degrees, I remember. So I'm also very happy to be here, enjoying a bit the spring and more of a warmer degree. So the head of the chair is Professor Dr. William Quinton. He's a medical doctor. He has a master's in health policy planning and financing and rehabilitation in public health. The main research priority that the head of the chair is interested in planetary and public health, healthcare system, health services research in Europe and Africa. In our team as well, there's the postdoc, Dr. Carmen Jochem. She's a medical doctor with a master's in global health policy, and her main research priorities are in relation to health promotion and prevention through nutrition and promoting physical activity, and planetary health literacy and education. As part of the team, I will introduce myself in a bit. Our main research area so far tackles the planetary health policy, estimation of the cost of climate change, specifically on the German healthcare system, development of indicators to measure the sustainability of hospital, and checking the health impact of climate policy and the climate impact of health policy, in addition to focusing on planetary health education, planetary health literacy, and promoting health through, like I mentioned, our main focus together with Carmen on diet and active mobility. Additionally, we are involved in the master's program at the University of Bayreuth in relation to planetary health. while we give courses in climate change, medicine and climate change, global health policy, scientific writing, lecture series where we host guests from different disciplines and universities, in addition to research in planetary health, and FHB, which is the virtual Hochschule in Bayern, where we provide an online planetary health course. So far, it is given in German. The plan is to extend it to be given in English as well as in the Profi Campus Academy in Uni Bayreuth, that is more dedicated to international students who want to be integrated in Germany and learn more about planetary health. Here I come. As Margareta mentioned, I have a Bachelor in Nutrition and Dietetics and a Master's in Global Food, Nutrition and Health from the University of Bayreuth. My main research and project priority focuses on planetary health, sustainable diet, digital public health intervention, as well as on health equity and disparity. I will talk further about the UBT Green Talks, but it is not a podcast, it's a video series. So it's published on the university main YouTube channel. We'll talk about it in a little bit. So in this presentation, I would like to walk you through my journey, actually, from the past to the present to the future. And how is that related to planetary health in a way and another? It all started during my master thesis on global food, nutrition, and health, where due to the need to promote healthy and sustainable diets, but mainly due to the gap in research and literature when it comes to insights on the behavior, on eating behavior related to sustainable and healthy diets. In addition to the lack of the global perspective, most of the study have tackled the knowledge in sustainable diet and not much the eating behavior. And most of the research have tackled the Western countries with a lack of insight, lack of a global insight. That's why the main aim of the master's thesis study was to investigate cultural differences and their impact on eating behaviors in the aim to promote healthy and sustainable diets on a global level. For that, we had 3 research questions. One was to wonder if the people's understanding to sustainable diet is the same as their understanding of a healthy diet. Second question, is there a difference between where the people grew up, global north versus global south? And the third question was, is the understanding and actually eating behavior when it comes to sustainable and healthy diet is similar? For that, we combine 2 methods. First of all, it's a fake food buffet. I'm just wondering, have you ever seen a fake food buffet before? Any of you?
Is that what?
Fake food buffet. So it's a research method that focuses on studying eating behavior, where the participants are actually, all what you see right now is all fake. It's made out of plastic that looks so realistic. And the aim is to make the participants be under a specific condition or controlled condition it depends on what the researcher is studying, is to study the eating behavior, because it's actually a buffet. So you pick up a plate, you put together from the ingredients you have a meal, and then the researcher at the end, of course, depends on the aim, take picture, weigh the food, and then compare them to realistic and real food, be it on calories, be it on macro or macronutrient content. For that, we used this method in addition to an online questionnaire. What was the task? Of course, after signing the consent, the participants were asked to put together a typical meal. So how would you understand a typical meal? And they, as you can see a little bit right now, I don't know if you're a bit familiar to the German cuisine. This is mainly very similar to a German cafeteria option. Okay, so we have the sausages, we have potatoes, some regional and seasonal vegetables as well, in addition to some vegetarian and vegan options. After serving the typical meal, the participants were asked to put together a healthy meal. Third task, a sustainable meal. In between, there's a manipulation check where the participant had to write the meal rating or to tick the meal rating and the task difficulty. And then at the end, they filled in a food sustainability online questionnaire that is inspired from FUMP. We did some adaptation, that adjustment to have it adapted to the German food. And that was to test the knowledge. So with the fake food buffet, we were checking the between and within participants' eating behavior, and that was for the knowledge. What did we find at the end? As a result, there was a difference. The global north, they were equal sample size, by the way, I did not mention that. So the global north participants served meals that are more in vegetables, higher in vegetables, plant-based protein and grains compared to the participants from the global south. Knowledge, there was no significant difference between the two groups. And when it comes to healthy and sustainable diets, participants who served sustainable diets or sustainable meals actually were higher in vegetables, plant-based and grains, and compared to the healthy meals. And here that showed that there is still this overlap when it comes to the understanding of what is sustainable and what is a healthy diet. What does that have an implication? In the discussion, I mentioned that the importance of having the future intervention when it comes to diet that takes into consideration the cultural differences, in addition to the need of having awareness and educational campaign. That taking into consideration, of course, the multidisciplinary approach, where it's not only about involving the public health experts, but also policymakers and the food industry in order to have a real change. For that, I'm happy to say that I won 2 awards for the master's thesis study. For the first one, it was provided from the University of Bayreuth. I got the third a place for contributing to the 4 Sustainable Development Goals: good health and well-being, quality education, reduced inequalities, due to the fact of comparing the globals and the sustainable diet understanding, in addition to a campus, the new campus in our university in relation to food, nutrition, and health. And it's also made me write my first manuscript that it's actually now under review, and fingers crossed, maybe it will be published maybe before I come back to Germany. With my supervisor, master's thesis supervisor, Professor Dr. Laura Koenig. What I have done after my thesis was I collaborated in multiple reviews at the different stages. And from that, I would like to draw this puzzle together with you today to see how I'm continuing this path in relation to planetary health, sustainability, and sustainable diets. The first review was the consumer's perception of novel food and the impact of heuristics and biases. In the systematic review, there were some reasons why the people had this fear. For example, when it comes to the neophobia we found there, or the disgust to try the novel food, for example, insects, or for example, cheesecake made of, in some of the study, they were offering, for example, cheesecake made of insect flour. Mainly, there were the social cultural factors that had an impact, of course, in addition to emotion and the personality traits, but it is definitely the specific cultural norms that it's common across country that has this impact on their willingness and their perception of novel food. Second of all, I've assisted as well collaboration in a scoping review When this narrative scoping review, where it was related into the digital health divide when it comes to digital intervention that tackles eating behavior, weight loss interventions, and so on. And for those who are not familiar with what is the digital health divide, it's when it's obvious that the health interventions the aim is to improve health, but there's this divide that exists due to the impact of socio-demographic factors where the disadvantaged population actually have this less effectiveness, and maybe the digital divide would increase this gap in between the groups. And for that, we were studying or looking at the mechanism behind this digital divide. And of course, the socioeconomic disparities when it comes to the effectiveness of digital health intervention. There were psychosocial mechanisms that were inconsistently conceptualized, described, and measured in the literature, and that emphasized the need to further investigate the mechanism, further investigate this gap, further investigate the disparity, the reason behind it, and try to fix it. Additionally, as I have been involved and I have been part of a team where we created a digital health intervention to promote physical activity and eating behavior in primary care setting in Germany, in rural areas. And for that, we took into consideration, since we are tackling the rural areas in Germany, so it's more or less a disadvantaged population between brackets. And for that, we studied the social media interaction and their impact on adhering to weight loss goals as well. It was also a systematic review. But what was remarkable for me, and I'm highlighting the main thing in the reviews that I've collaborated on to bring you up to what I am doing right now, is what we have noticed is that this very few number of studies out of the included study that investigated potential social inequalities when it comes to the uptake, when it comes to the effectiveness, when it comes to the engagement with those social media health interventions. So the gap is clear. There is disparity, there is an inequality, and there is a lack of evidence from different and multiple perspectives. And finally, we are actually now in the quality appraisal phase, another systematic review that studied the impact of sustainable diet on cancer incidence and mortality. And there's this proof of relation so far of following a planetary health diet and sustainable diet and on the incidence of mortality of cancer. As I said, it's still ongoing, and the results we are in the result phase now. For that brings me, okay, what do I want to do? After all what I've studied, all what I've contributed and collaborated on those different reviews, I see myself focusing on planetary health literacy. What is planetary health literacy? We will know in a bit. With a focus on bridging the disparities, and specifically among students, and specifically with a focus on healthy and sustainable diet. It sounds a little bit like a long title that I will try to divide a little bit in the upcoming slides. But first of all, to further explain the aim is to combine what I have seen so far, that there's this need of a cultural sensitive and global applicable public health interventions that contribute to a better, a healthier, a more sustainable society, especially using education. As I don't know your background, I'm just wondering if you know what planetary health is. I see no, I see yes, I see yes, yes, no, no. I don't know about the online participant. Nevertheless, I will go quickly then, because I've seen a yes or a no. What is planetary health? So choosing a couple of definitions identifying planetary health. It is the achievement of the highest attainable standard of health, well-being, and equity worldwide. And that is done through not only looking at the human system, but also the interaction with the nature and natural system, and also taking into consideration multiple disciplines, be it political, economic, and social. And that's the main aim, to have this humanity flourish. So that's the main aim of planetary health. There's this graph that includes the human health, include the welfare, include the One Health, public health, but there's the global health, and above all of these comes the planetary health. It is a solution-oriented transdisciplinary field and social movement, according to the Planetary Health Alliance, that focuses on analyzing and addressing the impacts of human disruption to Earth's natural sciences and their impact as well, because it's a cycle, on human health and all life on Earth. I will go again then quickly through the impact of the human activities, but also the climate change on human health and vice versa, because that will lead into what we already, I think we all know, and we all hear from the news what's happening around us, this ocean acidification, this extreme temperature that we see, the rise of the sea level, maybe I'll go back a little bit here, the pollution, and all of that would have impact on health. So the human activity and climate change has an impact on the natural system, on ecosystem, on biodiversity, and that will have an impact back again on human health, on the cardiovascular system, having more diseases, allergies, and so on. That is also what we see due to the growth in the population and the water use and the food waste, and all of that would have an impact back on us. There's a very nice website, but now, since my laptop is not here, you can go through the Planetary Health Check 2024, and there you could see recent updates and reports about what's happening in relation to the planetary health boundaries, and where in each country, how much we are crossing these boundaries. For that, we need action. For that, we need to make a change. For that, we need to promote planetary health. And one of the ways to promote planetary health is through education. For that, there are, according to the framework, Planetary Health Education Framework and Roadmap, there are 12 cross-cutting principles for planetary health education. That takes into consideration communication. Let's start with one. Takes into consideration planetary health lens, the urgency of action, of course, the policy and the importance of policy making and policy action. In addition to organizing, communicating, having this system thinking. It's a complex system thinking. It's transdisciplinary, but also we need to take into consideration the inequality and inequity and biases and governance and unintended consequences that may arise. In addition to the global citizenship, global identity, historical and current global values. These are principles to take into consideration in relation to planetary health education. Further in the framework, we see the interaction and interconnection within nature and within the Anthropocene. So this human nature interconnectedness and their relation to the Anthropocene and health, equity and social justice, the system thinking and complexity, as I mentioned, and it showed in the principles, as well as the movement building and system change. The main aim to have an efficient planetary health education is to take this interconnection into consideration in order to build a trust. I like very much the combination of all of these factors, because that gives the efficiency of a real effective education, because it has to be transformational, it has to be transdisciplinary, more focused into problem solving. It's very good to have it experiential, where the people learn by doing, for example. Definitely taking into account the cultural, social, and environmental contexts. Valuing equity, social justice, and considering the barriers for learning. And that can take place in different resources. For example, in curriculums, or in certificates and degree programs, in case study, in guides and methodologies. So in each of these resources, these principles could and should be applied. The factors of having this efficient planetary health education could and should be applied. But there is still something missing. There is still this deep understanding of the planetary health education to make it more efficient. And here we looked at the literacy concept, because there are plenty of literacy concepts and definitions. Health literacy, ecological literacy, environmental literacy, sustainability literacy, climate and health, transformative, as well as environmental health. What does that all mean? Why are all of these definitions, and where does the planetary health literacy come? And for that, before I give you the definition of planetary health, of the proposed planetary health literacy definition, I would like you please to go into Mentimeter using the QR code or the website and code, and just let me know. I'm curious to see what would be your understanding of planetary health literacy. Then what? I would like, if possible, to go to the slide and see the answers. Do we have like internet, or I can click, or I can just maybe open my laptop in this case?
Maybe open your laptop.
Okay.
Yeah.
So I hope, is it working, the code? You could access the website? Okay, great, thanks. So I'll give you a minute. Maybe also for the people joining online. And I will check the answers here. Okay. So, I'm not sure if the people joining online could see that maybe here I can just turn the laptop. So there were answers like ecological integrity, interdisciplinarity, ecological equilibrium, local food systems, non-anthropocentricity, all living things, local food systems, self-reflection, biodiversity, empowerment, holistic awareness, education, sustainability and understanding, climate education, integrated causality, interdisciplinarity, being aware, global balance, holistic, and multi-system. I think maybe some answers are still coming, but that's already quite interesting and nice to see all of these ideas coming up. Because that's basically all of the combination of what we answered comes to the definition of planetary health literacy proposed by Joachim et al. In their studies, where they focused on the planetary health that not only literates individuals but also society, and takes into consideration the three different levels of action: individual, societal, and global. The four core competencies behind the definition of planetary health literacy are the following. It starts with the access, understand, then appraise and apply. To have a further and a clearer definition, using the definition of planetary health that I've mentioned at the beginning, the proposal from Joachim et al. Was to define the planetary health literacy as the knowledge, but also the competencies of accessing, understanding, appraising, and applying the information. Because if I just have the information, that won't make much difference. That won't be enough. I have to understand it, I have to filter it, but then I have to do something with it and apply the information and knowledge that I have. And that in order to make judgment and decisions regarding the planetary health, not only among individuals, but also across societies, for health promoting and for transformative actions. For that, the focus, with all those frameworks that we've seen, all these education resources that I mentioned, be it the curriculum, be it what else, those programs and certificates, the concept should be considered and integrated in those resources. And that could be also relevant for educational programs that use, for example, the framework that we saw earlier, or other also existing principle and concept in relation to planetary health education. For example, let's focus again, bring back the topic to health and sustainable diet, combine the resources, the framework of planetary health education, combine the definition that we know now about planetary health literacy, combine the core competencies that are essential to be integrated in the planetary health education resources, and give an example for a healthy and sustainable diet now at the individual level. And the rest of the study, you would see further examples on a societal level and other examples as well. For example, here there's the active transport. So, on the first step, which is accessing or obtaining the information, first step would be saying that, yeah, I am able to access the information that informs me on, for example, the calories and nutrients and the impact on the ecosystem, because here we're studying the planetary health. So back to the definition of planetary health and this interconnectedness between the human and nature and environment. So I study first the impact. I have access to know the information on the human health, but also on the environment. And after that, I'm able to access the information on the nutritional value and benefits, for example, of an avocado. And I can know as well the information on ecosystem impact of this avocado. So I have now two information, health and environment impact. After the access of the information, I want to understand this information. I am able to easily understand the information provided and derive the meaning of this information regarding the benefits on my own health, but also on the ecosystem. By choosing specific fruit and specific vegetable, I am able to understand which values the consumption has for my personal health and the health of the environment. After that, I can judge. I can interpret the information that is provided, and that enables me to evaluate the information and weigh the pros and cons. So now I'm judging more. I have this plus and minus in my decision so that I can move into the apply phase and make this informed decision. Make the choice, and I would pick this fruit, I would pick this vegetable because it is beneficial, because I already accessed, I already understood, I already judged, and then I acted. What am I actually doing? At the chair of Planetary and Public Health, as I'm involved in a couple of projects. To follow up on the FAHB Planetary Health course that is now provided in German, there's the cross-sectional study to assess the knowledge and interest in planetary health and health-related study. This time, we are focusing on doing it in English and for the students who are studying these programs in English. And that we are now finalizing the survey. We're going to start spreading the surveys in German university for international students and students enrolled in health-related programs to check their interest and knowledge in planetary health. For that, I have added the section on focusing on certain socio-demographic factors that includes, for example, migration background, that includes rural and urban location, and that includes the continent that the study participants grew up from, and that to build up on the disparity and equity check. Additionally, I took part in the DGSMP symposium last September in Germany, that is focused on medicine and prevention. If I'm not mistaken, it's German, Dutch, wait, Dutch Gesundheit, Social Medicine, Prävention. Where as a part of the symposium on planetary health, I presented the master's program at the University of Bayreuth, Environment, Climate Change and Health, that I'm partially assisting in the coordination of this master's program together, of course, with the chair of Planetary and Public Health, and propose the curriculum, see the transdisciplinarity of this program, see the accreditation that we received, and how we are further developing this program. Additionally, Additionally, I made a visit to Göttingen for a couple of days to attend the culinary teaching kitchen that they have. At that time, it was a preventive medical course where the med students was more targeted to medical students who have access to online material. For example, each day they have specific modules related to cardiovascular disease, for example, or malnutrition. They have access to the material, they study the material, and then in the afternoon they come to the kitchen. There are a selection of recipes that are, of course, in relation to what they have studied in their module. And there they are. They have the ingredients and they just start cooking in groups. So there's this fun learning by doing factor. And then at the end, they all have the dinner together. We had a chit chat about each group, how did they do the recipe, how did they use it, why did they use this ingredient, how is this related to what they studied, why is this used, for example, as a high source of vitamin C, why is that helpful for the irritable bowel syndrome, for example, and so on and so forth, and have this discussion as a group. And I found that very relevant and very relatable to the concept of experiential learning. Additionally, also in September and October, actually, this year, I took part for the second time in the summer school of planetary health in Würzburg, also in Germany, but this time not as a participant, this time as an alumni to present the UBT Green Talks. What is the UBT Green Talks? After I joined in semester in September 2023, the summer school, the idea was to create a project during the summer school where we're divided into small groups and had this feedback from one another to develop our project ideas. And my project idea, after less than a year, came up into reality. And it was not only an inspiration, it was an action. And here you can scan the QR code of the playlist, because the UBT Green Talks, as I mentioned before, it's already published on the university main YouTube channel. And the main aim of these video series and these episodes is to raise awareness as a main goal. It's back to the planetary health education umbrella, to everything related to sustainability and planetary health and the interconnectedness between environment, climate change, and health. It also promotes education, not only focusing on the Master's Environment, Climate Change and Health, but also all the relevant programs that we offer at the University of Bayreuth and elsewhere as well. But we also present projects that are relevant to the topics of planetary health, sustainability, environment, climate change, human and public health, and the interdisciplinarity within and outside Germany. Because we have contribution from the Ecological Botanical Garden in Bayreuth, also from the Klimawald, where both of them have their input when it comes to ecosystem and biodiversity loss. We had also an input where we went to Edeka in Kulmbach, and we had this vision of how students would pick food choices when they were asked to put together a healthy and a sustainable dinner. So that was more in relation to planetary health diet and food choices. There is also input from the Faculty 7 at the University of Bayreuth, where we're planning on going to the lab to check what the students there are evolving when it comes to novel food and, for example, insect-rich protein alternative. And as well, and as well, there's the recent upcoming input from the University of Melbourne, where we are planning to do shooting the upcoming week, and topics related to science communication, to equity and just transitions, and other potential collaborations as well. Finally, to go back to the main topic of my future PhD, where I want to focus on planetary health literacy, especially on bridging and minimizing disparities among students in relation to the healthy and sustainable diet understanding and behavior. What I plan on doing to achieve this goal will be divided into multiple possibilities, multiple projects, be it research, but also current involvement in certain projects. First of all, to go back to the experiential experience when it comes to teaching kitchen, but this time more in relation to the planetary health diet, and try to duplicate it as well in Bayreuth and elsewhere. Follow up on the sustainable food study using the fake food buffet, and that in collaboration with the University of Vienna. Continue with the UBT Green Talk episode. We're planning on finalizing the first season at least, and then including it next summer semester in one of the modules provided at the university as part of the lecture series, and that also in relation to planetary health education. And finally, after finalizing the assessment for the FAHABE planetary health course, develop the course in English and have the survey that would check pre and post-course impact on knowledge and understanding, interest, and also behavior in relation to planetary health literacy. And with that, I come to an end of my presentation, where I would thank you again for this opportunity, and I'm looking forward to your comments and your questions.
So which way the way. I can't say to be. So let's open up the floor for questions, both online and in. Is anyone question? Like, different countries, there are like staple trees that they eat during, maybe it's like a festival or like just like a time of the year where there's like a celebration where we have to eat these specific foods. But oftentimes these specific foods are very meat heavy and generally not the best. How, like, what would be some ways that we can kind of address those challenges, like being able to respect those cultural practices, but also, like, taking into consideration the environment as well?
Thank you for this question. Actually, in the Planetary Health Diet from Lancet, after, of course, defining the food groups and aiming for a more plant diet, more vegetables and fruit consumption, less consumption of meat, less consumption of dairy, less consumption of sugar and processed food, there is the cultural factor that is taken into consideration. So the diet should be adapted to the culture, should be adapted to also the availability, accessibility, seasonability of the food provided. So that is taken into consideration in the Planetary Health Diet. And that's, I don't know, I cannot maybe show it, but there are definitely the resources that you can find when you check the Planetary Health Diet and Lancet Food and see how the guidelines are. So the culture is definitely a factor that is taken into consideration. Yes. Yes. So it's a replica of it's realistic food that are made out of plastic. So actually they look quite real. I do remember when I had the study and the participants coming over at the beginning, there was like a shock first that is that real or fake, and even some of them started like smelling the food or trying to touch the food and see how they feel, because they look as real food. And the aim is to put the participant in this position that it's like real food and I'm gonna put together the meal in my plate because it's somehow real. Yeah.
So growing meat and those cultured meat, like how it's just drastically improves the efficiency and the sustainability of meat.
I missed just the first couple of words from your question. So you're asking about the culture. Yes,
cultured meat.
Yes,
like lab grown.
Yeah. What's the question exactly?
Just has this kind of option been considered in regards to...
Yeah, there are a lot of I'm not fully aware of the current studies, but I know for sure that there are a lot of studies in relation to the lab cultured meat. And for example, that's one of the things that we will be doing in the upcoming episode of UBT Green Talk, where we visit the lab at the Faculty 7, because it's currently there are a lot of even studies that I recall, I think, comparing the taste and comparing the nutrient content of the cultural lab meat, but I'm not very much aware of the of that. But that's now one of the options of the novel food. So insects, for example, is one of them, but cultured meat is also another option. Yep.
So at the back first, and
So thank you for your presentation. It's very interesting. I guess I have a question around the anticipated challenges and maybe some of the solutions that are being considered around dealing with the food industry, given how cheap, non-sustainable, non-healthy foods are. What are we anticipating in terms of overcoming that hurdle?
Yeah, that's definitely something to consider, and maybe, like you mentioned, a hurdle and an obstacle. And that's why the need of collaboration somehow. Like it was one of the implications that I discussed in the potential first manuscript that I have in my master thesis, because academic and research and public health experts can do a lot, of course, but if you don't have this collaboration with the policymaker, if you don't have this collaboration with the food industry, that will not be as effective. But there are also at the same time a lot of newly industry that are engaged, as we see right now, under the umbrella of planetary health diet and vegan food and healthy food and environmentally friendly food. And why not having a score later on, or certain label as well, because we do see the labels right now. Because eventually the food industry, I think it's just the personal opinion here, eventually they need to reply to what the people want, right? So if you have a growing population of interested people in health and environment, then I think at some point they would answer and reply to that.
Thanks, Marta, for your presentation. It was really interesting. I've been working a lot for like almost a decade in sort of this advocacy space around raising awareness with young people about planetary health, connecting young people to their food source and food system. And it does feel like I'm working against the tide. So I'm really interested in this curriculum that you're talking about around planetary health, and whether there is any literature on that now, because basically for the last 10 years, I've been sort of creating my own literature, using my own knowledge and whatever data is available and evidenced. But I think, when we're talking about the food industry being completely unstoppable at this point, and then, researchers sort of working in silos and then not communicating the data effectively out of that silo, I think the best response is coming up with a robust curriculum where you can actually reach out to young people, because they are the future, and also within the universities and whatnot, because I think, that's sort of from my experience as a practitioner, that's really what I need terribly at the moment, and especially like connecting Indigenous young people back to the land, and also disrupting sort of this neoliberal food system that's sort of imposed, especially in the Pacific. I don't know if you've done any research in the Pacific, but it's problematic there. I mean, I keep saying, like, if climate change isn't going to wipe us off the face of the earth, it's going to be poor diets, honestly. Like, the NCD rate there is horrific. So yes, my question is around the curriculum and when it's going to be available. And I'm actually really interested in the university now. I've been looking at like food systems and whatnot, so maybe we can have a separate talk.
Yeah,
Cool.
Yeah, thank you very much. Thank you very much. And I'm definitely also interested in the insight from the Pacific as well. And it is challenging so far as trying to combine a little bit the different points that you mentioned, because they were all interesting. The development of the curriculum, if you mean the English version, for example, of the Fahabe, is ongoing, because the first step would be to have this need assessment, focusing on students, focusing on the health-related majors, because true that students are the young generation, they have the impact like you mentioned, but also having this relation to practitioners somehow in the health field would also have its own impact. There was a previous a study done in this sense, focusing on, for example, nurses' knowledge and understanding and interest in planetary health. And there were multiple results in this. So there is this need of tackling specific target groups into the education and have this flow for the future generation, and that needs built up. And I feel that also needs the collaboration, like you mentioned, because it would be amazing as a bigger vision to have one curriculum, not only within like the same country, within between university, but also between countries as well. So have this homogeneous one curriculum of planetary health. And that's something I feel very interesting to build up. It needs work, it needs networking, brainstorming, and so on. And a lot of research as well, that it's relatively new. For example, the concept of planetary health literacy, one of the barriers is to have people accepting it first. So you have to, in order for this to be valid, you need the people's acceptance to it, and you need to have also the involvement of stakeholders and food industries in it. So these are barriers definitely that need to be surpassed first.
Thanks, Werner. Sorry, I'll keep it quick because I know we're out of time. You talked a little bit about, well, first of all, the master's program, the environment, climate change, health. That sounds really cool. You talked a lot about working with health students and medical students as well. I'm wondering whether you also work with environmental and agricultural students, and kind of the other side, I guess, like if there's health and environment, do you also have input into the programs and teaching environmental students about planetary health?
Good question. Actually, there's the Nachhaltigkeit certificate, which is like an additional certificate in sustainability provided at the University of Bayreuth. And there are students who are interested, obviously, in the topic, but also they develop their own projects. And some of them are in relation to agriculture and environmental work. At the end of the certificate, for example, the student would develop their own project and have it into action. Another way we're involved in that is through UVT Green Talks, for example, where we publish and talk about these projects. What else? In the master's program as well, there are the courses and modules that go into ecology and geoecology and environmental field visits as well. So it is, because in this master's program, what is really nice is, and it's actually the main aim of the first thing that we were accredited with due to this interdisciplinarity and transdisciplinarity.
Spoke about curriculum of use the better Latin.
Again?
There's something called the better Latin.
In the curriculum? Yeah. Yeah.
And a lot of other researchers from around the world.
Yeah.
Gives a few perspective. That's just very perspective. And
yeah. Curriculum, you mean of which course?
yeah, you spoke about developing a curriculum.
Okay. So
On similar lines, there is a website called the Better Latins, which you can use for your education as well. And teaching young people. So it gives you a few perspective of the how to develop transdisciplinary perspective.
Thank you.
It's just something old as the work any market was done.
Any other questions? I have one that, so if you would like the audience to leave with one message, one key message in mind, what would it be?
Well, I think by now I have a little bit of an idea maybe of your background. I think my message would be that, I think urgent action is needed. I think we're all aware of what's happening in relation to climate change and its impact on human health, and vice versa, the human impact and human activity on climate and environment. And I think we can all contribute and be, like we call, transformative agents somehow in different disciplines, whatever the background is, academia or environmental science, or in any project we can do something in this relation. And collaborating, starting now, despite the hurdles that would come, is something to do.
Yeah, that's beautiful. I like the transformative agents, and working within our spheres, creating.
Yeah.
Yeah, great. And I really identify with what you're saying about transdisciplinary and, because we need all aspects of society, right? We need the finance, we need the funding, we need the agriculture, and we need it's it was a really interesting talk.
Thank you. Thank you very much for the invitation.
Anyone? No. Oh, yeah. Well, actually, yeah. Now that this comes up, what do we do about bad actors? Like Coca-Cola, for instance. That's a company that is not contributing towards planetary health, either human or environmental. Looking at Nestle and Procter and Gamble. How do we actually compel change? We talk about urgent action, like getting all of the people on their boards lined up and dressed out and going through these issues with it, because there's a disconnect. And so I'm just wondering, from an academic side, how do we pull that policy to impact industry? Do you see any actual levers of change that are working?
Yeah, the first thing came up to my mind when you said that. I was like, yeah, maybe we start from within first, and then we see the impact on the others, because it's not going to be easy, and it's not that there's a need of any fight in here. I feel that the more we focus on education, for me, and that's the aim of why I'm personally interested in that, because to promote planetary health, I feel the first step is through education and raising awareness and having these 4 steps of not only giving the information, but following up on having this understanding and also the act upon. And I think that's a huge first, but a huge step towards hopefully a bigger change.
And that spectrum, right? Because we talk about the movable metal and then the 2 extremes, there are so many people who are ready to act and then start there. Hopefully, visually, yeah. Anyway, so that's the end of today's event. I'd like to thank Marina for sharing your time and expertise with us today.
Thank you.
And thank you also for everyone who came and engaged in discussions. It was a really rich discussion, which I learned a lot just from your questions as well. And if you'd like to revisit the seminar, a recording will be uploaded to the University of Melbourne's YouTube channel in the near future. We hope to see many of you at future events. And yeah, thank you. And thank you.
Thank you all.